Your fingers feel stiff the moment you wake up. Making a full fist takes a few tries before your hand cooperates. Your knee cracks on the way down the stairs, and getting up from a chair takes a little more effort than it used to. Opening a jar or twisting off a cap can turn into something you have to think about instead of something automatic. If any of that sounds familiar, stay with me for the next few minutes, because I want to show you something almost nobody brings up when it comes to joint pain. There's an old ingredient. It's been sitting in kitchens for generations, tucked into the same cabinet as cough syrup and vitamins nobody quite remembers buying. A real clinical study followed a group of people already on the waiting list for knee replacement surgery. Researchers gave half of them a single tablespoon of this ingredient every night, before bed, for about 10 to 12 weeks. The results were dramatic enough to make headlines at the time. Now, I know what you're probably thinking. You've likely already tried the usual joint supplements, maybe more than one, and you're still waking up with that same stiffness, reaching for the same bottle of pills that never quite delivered what the label promised. Here's what's fascinating. This ingredient works on a completely different target. The research points to it slowing down the actual process, breaking down the cushion inside your joints, the one nobody ever explained to you in a 7-minute doctor's visit. Stick with me, because by the end of this video, you'll know exactly what this ingredient is, why it works, and how to use it tonight. Most people believe that joint pain is simply the price of getting older, something you're supposed to accept and manage rather than actually improve. When the pain gets bad enough, the usual next step is picking up a bottle of glucosamine or chondroitin, because that's what everyone recommends. Here's why that's not quite accurate. A meta-analysis covering multiple randomized trials involving thousands of arthritis patients found that glucosamine and chondroitin produced only a small improvement over a placebo pill. A modest, inconsistent result, nowhere near enough to explain why these two ingredients dominate the joint health aisle at every pharmacy in the country. So if the most popular solution barely edges out a sugar pill, why does everyone still reach for it first? Heavy marketing built that reputation. The clinical research tells a much less impressive story. And it's not just the supplements. A lot of people end up leaning on over-the-counter pain relievers and prescription anti-inflammatories instead, things like ibuprofen or CAX2 inhibitors. Used occasionally, they're a genuinely useful tool, used every single day for years, which is exactly how most people with chronic joint pain end up using them. They carry real risks: stomach irritation, kidney strain, and in some cases, increased cardiovascular risk. That's printed right there on the label, in plain language, for anyone who bothers to read it. It's exactly why researchers went looking for something that worked through a different mechanism entirely, without that daily trade-off. Now, here's the part that really gets me. Somewhere along the way, doctors started telling patients that cartilage breakdown is permanent, that once it wears down, all you can do is manage the pain until surgery becomes the only option. Utterly ridiculous. Your body still has real capacity to slow down, and in some cases even repair, the damage happening inside that joint. What's actually been missing is a treatment that targets the mechanism doing the damage in the first place. Every popular supplement focused on adding material back to the joint. Very few ever targeted the process breaking that material down to begin with. That distinction matters more than you'd think, and it's exactly where this gets interesting. Cartilage is the cushion inside your joint. It sits between the ends of your bones and keeps them from grinding against each other every time you take a step, climb a stair, or make a fist. When that cushion gets thin, bone starts moving closer to bone, and that's when you feel it. Here's the part almost nobody explains. Cartilage gets actively broken down by enzymes living inside the joint itself, enzymes called aggrecanase and collagenase. Think of them like a pair of biological scissors, constantly snipping away at the fibers that make up that cushion. In a healthy joint, those scissors stay mostly closed. The body keeps them under tight control, trimming small amounts here and there as part of normal maintenance. In osteoarthritis, those scissors get stuck open. They keep cutting, day after day, faster than your body can repair the damage. Here's a layer most people never hear about. Cartilage isn't solid tissue like bone. It's closer to a sponge, held together by a mesh of collagen fibers and packed with water-loving molecules called proteoglycans. Those proteoglycans are exactly what aggrecanase targets. Lose enough of them, and that sponge loses its ability to hold water and cushion the joint properly. This is actually part of why your joints feel stiffest first thing in the morning. Overnight, with less movement, less fluid gets pumped through that spongy tissue, and the stiffness shows up the moment you try to move again. This is fascinating. Researchers at Cardiff University found that omega-3 fatty acids from cod liver oil act almost like a safety lock on those scissors, directly reducing the activity of aggrecanase and collagenase and essentially closing them back down. That's a far more targeted effect than simply calming inflammation in general. Now, what makes cod liver oil different from a regular fish oil capsule? Cod liver oil carries vitamin D and vitamin A along with the omega-3. Vitamin D plays a direct role in regulating inflammation inside the joint capsule, and vitamin A supports the tissue lining that keeps the whole joint environment stable. You're getting 3 mechanisms working together instead of 1. So the real question becomes this: if this mechanism has been documented for over 2 decades, why does almost nobody bring it up? That's exactly where this gets interesting. Let's talk numbers, because numbers tell this story better than anything else. Researchers at Cardiff University in Wales ran a clinical trial with 31 patients who were already on a waiting list for total knee replacement surgery. Half of them took 1,000 milligrams of cod liver oil every day. The other half took a placebo oil. This went on for 10 to 12 weeks, right up until their surgery date. At the end of that window, the surgical team examined the actual joint tissue removed during the operation. In the placebo group, only 26% showed reduced levels of the cartilage-degrading enzymes we just talked about. In the cod liver oil group, that number jumped to 86%. 86%, from 1 tablespoon added to an existing nightly routine. The lead researcher, Professor Bruce Caterson, described it as a dual mode of action. Cod liver oil calmed inflammation and appeared to directly slow the breakdown happening inside the joint itself. Now, a second study adds to this picture. A separate trial followed 97 people with rheumatoid arthritis for 9 months, comparing cod liver oil against a placebo capsule. After 12 weeks, every participant was asked to gradually cut back on their NSAID painkillers if they could. Of the group taking cod liver oil, 59% managed to cut their NSAID use by more than a third. In the placebo group, only 19% could say the same. That matters beyond simple comfort. It means people needing meaningfully less of the medication that carries those stomach, kidney, and cardiovascular risks we talked about earlier. What's wild is that both of these studies are over 2 decades old, and the first one was even presented publicly at a press conference at the Royal College of Surgeons in London. It made headlines for about a week, and then it faded from the conversation entirely. Compare that to glucosamine, which continues to dominate every pharmacy shelf despite the marginal, barely there effect we covered earlier. Cod liver oil has 2 separate clinical trials tied to the actual mechanism of joint destruction and medication reliance. Glucosamine has decades of marketing and a much weaker track record in controlled trials. Did you realize the gap between what gets sold and what actually works can be this wide? Cod liver oil doesn't fit the supplement aisle narrative, and that data has been sitting there, untouched, for over 20 years. Let's talk about how to know if this actually applies to you. Stiffness that shows up after sitting for a long stretch, then eases once you start moving, points to the same underlying process we've been discussing. Pain that gets worse at night, even on days you haven't done anything strenuous, is another marker worth noting. Some people also notice a grinding or grating feeling in the knee or hip when they move, or swelling around a joint that comes and goes without any clear cause. Here's a simple way to check yourself right now. Make a tight fist with your right hand and hold it for 3 seconds. Now do the same with your left hand. Did one side feel noticeably stiffer or slower to close than the other? That kind of asymmetry is worth paying attention to. If you recognize 2 or more of these signs, this next part is directly relevant to you. The enzyme activity breaking down your cartilage happens quietly, in the background, long before pain reaches the point where it disrupts your day. Catching it here, while you're still just dealing with occasional stiffness and the odd grinding sensation, puts you in a very different position than catching it years down the road after a lot of unchecked damage. The earlier you interrupt this process, the more cartilage you actually have left to protect. Now that you know exactly why this works, let's get into exactly what to do. Take 1 tablespoon of cod liver oil at night, roughly 30 to 60 minutes before bed. Take it with a small amount of food, a few crackers, a spoonful of yogurt, even a bite of toast. Fat helps you absorb it properly, and food in general makes it easier on your stomach. Do this every single night, consistently, for the full 10 to 12 weeks, the same window used in the Cardiff University study. Mark it on a calendar if that helps you stay on track. Quality matters here more than people expect. Look for a cod liver oil that's been third-party tested, stored in a dark bottle, and kept refrigerated once opened. Fish oil oxidizes quickly, and a rancid product tastes unbearable and can upset your stomach instead of helping it. A sharp, overly fishy smell is a clear sign the bottle has already turned. Liquid form tends to absorb better than capsules, and 1 tablespoon of liquid gets you a meaningfully higher dose than the 2 or 3 small capsules most bottles suggest. Check the label for the actual omega-3 content, not just the serving size. If the taste is what's been holding you back, and for a lot of people it genuinely is, a few tricks make it much easier to get down. Take it straight from a small shot glass rather than a spoon, followed immediately by a sip of orange juice or a bite of something citrusy. The cold temperature and the strong citrus flavor mask most of the fishy aftertaste. Some brands also come in a natural orange or lemon flavor made specifically for this reason. It's a small adjustment, but it's often the difference between sticking with this for 12 weeks and giving up in the first week. Realize this: the dose matters just as much as the ingredient itself. Using half a teaspoon here and there isn't going to move the needle on those enzyme levels we talked about earlier. Try this for 30 days first. Track how your hands feel in the morning and how your knees feel on the stairs. Then carry it through the full 10 to 12 weeks and prove it to yourself. Now that you know what to do, let's talk about what to actually expect, week by week. Weeks 1 and 2. Sleep quality tends to shift first. Omega-3s support the nervous system in ways that show up before anything changes in the joint itself. Many people fall asleep a little easier and wake up slightly less groggy during this window. Morning stiffness might ease just a touch, but the bigger changes are still ahead while your body builds up omega-3 levels in its tissue. Weeks 4 through 6. This is typically when people notice something concrete. Getting up from a chair feels a bit smoother. Climbing stairs produces less of that sharp catch in the knee. Making a fist in the morning takes less effort and less time. This lines up with how long it generally takes omega-3 fatty acids to accumulate in joint tissue at meaningful levels. Weeks 8 through 12. This is the window that matches the Cardiff University study we covered earlier, the same 10 to 12 weeks those patients followed before their surgery. This is the range where the drop in enzyme activity becomes measurable and consistent. Now, about the phrase in the title of this video. Rebuilding cartilage overnight describes that nightly repair window, the hours each night when your body has a real chance to work on this process, adding up night after night. Real change here builds gradually on a weekly and monthly timescale. Give it the full 12 weeks before you judge whether this is working for you. Let's talk about what pairs well with cod liver oil, because a few smart additions can amplify what you're already doing. Vitamin D is already riding along inside that tablespoon, which matters more than most people realize. We touched on its role in calming joint inflammation earlier. What's worth adding here is that vitamin D deficiency is extremely common in adults over 60. So cod liver oil is quietly solving two problems at once. Getting your levels checked with a simple blood test gives you a clear picture of exactly where you stand. Turmeric, specifically the curcumin inside it, makes a strong partner here. Curcumin works through a separate anti-inflammatory pathway than the omega-3s in cod liver oil. Picture two maintenance crews working the same job site from different angles. One crew shuts down the enzymes breaking down cartilage. The other calms general inflammation throughout the joint. A half teaspoon of turmeric mixed into food, paired with a pinch of black pepper to help absorption, works well alongside your nightly tablespoon. Here's something worth watching closely. Vitamin A builds up in your body over time, stored in the liver, and cod liver oil already contains a meaningful amount of it. A multivitamin with high-dose vitamin A, or regular servings of liver, adds to that total. Keep your overall vitamin A intake in mind across everything you're eating and taking, not just the tablespoon we talked about. Movement itself works as a synergy here too, and it costs nothing. Synovial fluid, the fluid that lubricates your joint, only circulates properly when the joint actually moves. A short walk, some gentle range of motion stretches, even just standing up and shifting your weight every hour if you've been sitting a long time, helps pump that fluid through the joint. Pair that daily movement with the tablespoon at night, and you're supporting the same cartilage from two different directions. One through fluid moving nutrients in during the day, the other through enzyme activity slowing down while you sleep. A handful of intentional additions is the goal here, not a growing pile of supplements on your kitchen counter. Cod liver oil at night, vitamin D levels checked once, turmeric with your meals, and a bit of daily movement. That's a complete, well-rounded approach supporting the same mechanism from multiple directions. Let's talk about the mistakes that quietly cancel out everything we just covered, because I see people make these constantly, confusing cod liver oil with regular fish oil. This happens all the time, since the bottles sit right next to each other on the shelf. Regular fish oil gives you omega-3s. Cod liver oil gives you those same omega-3s plus the vitamin D and vitamin A we talked about earlier, the two nutrients that support the joint capsule directly. Grab the wrong bottle, and you're missing 2/3 of the mechanism. Buying a product labeled cod liver oil that's actually a blend, diluted with cheaper filler oils to cut costs. Check the ingredient list, not just the front label. A legitimate cod liver oil should list cod liver oil as the only oil, and clearly state the actual omega-3 content per serving. A vague label about the source or the amount is a sign to look elsewhere. Treating this as optional some nights and skipping it on others. Consistency is what drove the results in the Cardiff University study. A tablespoon 3 nights a week doesn't produce the same effect as a tablespoon every single night. Assuming that more is automatically better and doubling or tripling the dose to try to speed things up. Extra amounts create their own risks rather than faster results, especially with vitamin A building up the way it does. More on that in just a moment. Skipping the food that's supposed to go with it. Taking the tablespoon straight on an empty stomach while rushing out the door. That habit cuts into how much you actually absorb. And stopping after 2 weeks because nothing dramatic happened yet. The enzyme changes we talked about showed up at the 10 to 12 week mark in the actual research. Quitting at week 2 means quitting right before the window where results typically appear. Let's talk about who needs to be careful with this, because responsible information includes the exceptions. If you're on blood thinners, whether that's warfarin, aspirin therapy, or any prescription anticoagulant, talk to your doctor before adding cod liver oil. Omega-3 fatty acids have a mild blood thinning effect of their own, and combining that with an existing blood thinner can raise your risk of bruising or bleeding. Your doctor can check this in about 30 seconds and tell you exactly where you stand. If you have a known fish allergy, skip this entirely and ask your doctor about alternative omega-3 sources instead. Vitamin A deserves real attention here. Unlike vitamin C, which your body flushes out when you have too much, vitamin A is fat-soluble and builds up in your liver over months and years. 1 tablespoon of cod liver oil a night, taken as directed, stays within a safe range for most healthy adults. Combine it with a separate multivitamin containing high-dose vitamin A, regular servings of liver, or a prescription retinoid cream, and those amounts add up. Get your vitamin A levels checked if you're combining several sources long-term. If you're pregnant, vitamin A intake needs particularly careful monitoring, so this is a conversation for your OB before you start. If you have a diagnosed liver condition, your liver processes vitamin A, so loop in your doctor before adding this to your routine. Cod liver oil has been used safely for generations. These are simply the specific situations where a quick conversation with your doctor makes sense before that first tablespoon. Every single thing we covered tonight comes back to one simple action. Cartilage breakdown happens because 2 enzymes, aggrecanase and collagenase, stay switched on longer than they should. Cod liver oil helps switch them back off. 1 tablespoon every night for 10 to 12 weeks. Quality oil, taken with a bit of food, tracked consistently. That's the entire protocol, built around a single nightly habit that costs a few dollars a bottle. I want you to actually try this and genuinely commit to 30 days first, then push through to the full 12 weeks. Pay attention to your hands in the morning. Pay attention to your knees on the stairs. Write it down if that helps you stay honest with yourself about the progress. And here's what I'd love even more than you trying it. Come back to this video in a few weeks. Leave a comment and tell me exactly how your hands feel, how your knees feel, whether that morning stiffness has eased up at all. I read these comments. I want to know if this is working for you the same way it worked for those patients in Wales. If this video gave you something useful, something you haven't heard from your doctor in a 7-minute appointment, hit that like button. It tells me you want more videos like this one, built on real research instead of marketing. And if you haven't subscribed yet, now's a good time. I put out new videos every week, all built the same way, all backed by real science. I am Andrew Collins, and I will see you in the next video.